Since 1946, Murphy's Builder Supply has been serving the folks of Jessup, Wayne, and surrounding counties with quality products and knowledgeable service. Matter of fact, they feel they sell service first to make sure you get exactly what you need for your home improvement projects. And with each employee at Murphy's being there for 10 years or more, you know you're talking with someone with the experience to help you with building supplies, tools, paint, and all the things you need from a full-service hardware store. The best choice in home improvement is Murphy's Builder Supply, 156 Northeast Broad Street, Jessup.
7:59 here at the Big Dog WIFO-FM world-famous Butch and Bob Show on a Monday morning, brought to you by Murphy Builder Supply.
Good morning, Jonathan. We got a special guest in the studio today. We got hospital CEO Joe Ierardi, and got a lot going on, update what's going on. But first of all, let's talk about the flyover that took place on Friday. A lot of people excited about that. Joe, tell us how that came about and what it was about. And I know there are a lot of people out there to see the flyover.
Yeah, a huge crowd came out to see the flyover, something the Georgia Air National Guard put together. They actually called us the day before to tell us the time they were going to be flying over, and they were kind of making their rounds around the state. So it was something that the Georgia Air National Guard put together just to kind of pay tribute and honor, healthcare workers and the folks on the front lines, and they did it all over the state, and it was well received all over the state of Georgia.
I hadn't had you in there in a while. Said last time we had you is when we first had this talk about the COVID-19 pandemic. So, just go over, how the hospital's handled the situation. What's the situation been at the hospital? The preparation. Does the hospital have all the equipment and testing available? Just give us an update on how Wayne Hospital has done throughout this event, say, the last 2 months.
It's new. It's something that was different, but, infectious and contagious disease is something that we handle every day, and we utilize our universal precautions based on all patients that come in, so that was really no different. The difference with this one was we had to take some not only more internal precautions, but external, with limiting visitors and closing the cafeteria. Sorry, Jonathan. And doing things like that, which made it more of something that we not only took care of in-house, but really affected people kind of on the outside. But we've been very fortunate here in Wayne County. We've only had 14 cases, I believe as of 7 o'clock last night. I think we've only had one new case in the last 10 days. So the flattening of the curve or leveling things off, I think is definitely happening in our area. There's a lot of theories as to why we only have 14 cases. I think a lot of it is, again, it's a tribute to the people in our community, have listened to our officials and have done what needs to be done as far as distancing and not going places, not holding big gatherings. I think that's been an enormous help. I know in a couple of neighboring counties they had some larger gatherings, and that caused a little bit of a problem. There's also a theory that maybe we had a wave of this prior to everybody really knowing what it was. I can't tell you how many people have come to me and I've talked to that have told me that, back in mid-February or late February or even early March, that they know someone or they themselves had something and it had all of these symptoms. And I guess it could be very possible that we may have had a run of this, earlier before things really got ramped up. But, that's definitely possible because, and I think we've all talked to people that have said, hey, I had this or I had that. So it's really, really possible that maybe we had a lot more cases, but maybe they were more stacked up earlier in this whole episode. But so far, everything's going well. Folks have handled it extremely well. It's a little different not having any visitors in the building. It's tough for patients. You and I've talked about that. Patients. Some patients like to have visitors, and people like to go visit people in the hospital. And hopefully, sooner than later, we'll be able to lighten some of those things. But it just depends on what our state officials tell us.
It's really been a tough thing. I talked to a friend of mine. His son was in the hospital in Jacksonville. He couldn't even go in and see him. That's going to be tough for a family. You got a person in your family in the hospital, but you're there, but they won't let you in to see them. So I'm curious. What about people that have babies? How's that work?
Well,
newborns.
If you have a child, you're allowed to have one person with you. When you have that baby, we're going to allow the dad or whomever to come, a support person to be there. And if a child is under the age of 18, you can obviously have to have a guardian with that person. technology's been a big help. We utilize things like FaceTime and Skype and things of that nature to be able to communicate with family members and be able to, see their loved ones. But it's different. It makes things more difficult. But right now, it's really the right thing to do to protect everyone.
Things have to be a lot different at the hospital. I said no volunteer staff. Those people have been sent home as well, right?
The volunteer staff made a decision very, very early on that they were just going to wait till this kind of slowed down or kind of lessened, which was the right thing to do, because that's that those folks tend to be more at risk. So I think that was definitely the right call for them. So it's different. It's a lot different. No volunteers, no visitors. The cafeteria. I think one thing is the employees kind of like the cafeteria. They can get in and out a lot quicker, not have to wait in line. But it's different. It's just a sign of the times that we're going through right now.
Like I said, there's a lot of theories why Wayne County's so low. A lot of people ask, are people being tested? Is there testing available in Wayne County? Is there testing at the hospital?
There's no problem getting testing. We've tested almost 600 people. And I would say, in my mind, maybe we're doing 50% of the testing because there's sites, doctors' offices are doing them, Diversity Health Clinic is doing them, and throughout the area. And so we're, I think, just over 600 tests going as of yesterday. I've tested 600 people, so testing really hasn't been a problem, more so than anything else. In the very beginning, the tests were very slow to come back because, if you can imagine, the backlog, and that has shortened down tremendously. It was sometimes 7 to 8 days to get some of these tests back, which is crazy. And now it's within 48 hours, give or take. Usually we get a test back. So testing has really, really come a long way since the beginning of this.
Again, if you're just joining us, Joe Ierardi, CEO of the Wayne Memorial Hospital, in with us. Was the hospital prepared as far as ventilators and things like that? Hear all these stories around the country. They don't have this, they don't have that. Was Wayne Memorial Hospital equipped to have everything they needed?
Yeah, we have a 12-bed ICU, intensive care unit, and when you have an intensive care unit, you have to have all of those items like ventilators and machines of that nature. So that's not a problem for us. But it's like anything else, Bob. If we get, we're an 84-bed hospital. If we get, 30, 35 patients at one, have them at one time, and, 3/4 of those need to be on a ventilator, then, I don't care where you are. No one's, prepared for something like that. But we're as prepared for our facility as we can be.
And we hear all across the country, nursing homes seem to be affected. Are you in contact with the nursing homes here? It doesn't seem to be an issue here.
The nursing homes, there's a statistic out. 51% of the deaths in the state of Georgia are from people who live in nursing homes. 51%.
In the state of Georgia.
In the state of Georgia. And that's pretty much emblematic of what it is nationwide. So half the folks that have passed away from this have been residents of a nursing home. So they are definitely an at-risk population. A couple of counties around us have had large breakouts in nursing homes, and that makes their numbers go up. The state of Georgia has done a tremendous job with the Georgia National Guard coming in, really cleaning nursing homes and really giving them a huge coming in and cleaning them from top to bottom. They're doing that routinely. I think that has definitely helped. But that's what makes this virus very, very interesting is when you look at the numbers. It's really, really skewed towards the older population, people with underlying health conditions, and nursing home population. Again, think about that. 51% of the people in the state of Georgia that have died from the coronavirus live in nursing homes. It's a lot.
The governor continues to get criticized. He opened up early. I watched some newscast last night. They're like, we won't see a spike till several weeks. You got to wait and see. They're still giving a gloom and doom scenario. So your thoughts on that?
Well,
any idea?
I think he opened up 24 days ago. And so far, you got to watch what the words that people use. Well, the number of new cases is on the rise. Well, of course the number of new cases is on the rise. Every time if you get one case, that's going to rise in new cases. But what's the average new cases per day? What are your hospitalizations per day? And that's why that dph.ga.gov is a great site. It not only tells you what's going on in each different county, but it kind of tells you, it gives you the graphs and the trends of what's actually real-time data, what's going on. And if you look at those graphs, it's obvious that the amount of new cases per day is going down. The amount of hospitalizations is going down. The amount of deaths is going down. So we've opened up almost, I think, 24 days ago, and the numbers continue to go down. And I think it comes back to, we just have to use good judgment. The distancing thing, yes, we have to do that for now. How long we have to do that, I don't know. But for right now, we've got to do that. If you don't feel good, stay home. People ask all the time, what can I do to help? What's the best thing you can do? The best thing you can do is if you don't feel good, if you're running a fever, stay home. That's the best thing you can do. Protect yourself and protect others. All too often, that's been the problem with some of these really large outbreaks, is people knowing that they've had symptoms have gone somewhere where maybe they shouldn't have gone anyway, and that's what happened because it is so contagious. But when you look at the state of Georgia, I want to remind folks that there's 11 million people live in the state of Georgia, and about 1,600 people have passed away, and that's 1,600 too many. But when you look at it, that's a very, very low percentage. And even 36,000 people have gotten infected with this virus. But when you divide that by 11 million, it's a pretty low percent of your population.
Again, I think a lot of people forget that everything's being dictated right now by the governor's orders. He's controlling this right now, and like I said, he's making all the decisions, because people ask all the time, well, why aren't we doing this? Why aren't we doing that? Everything locally is being dictated by the governors. Right now he has the shelter in place for the elderly until June 12th. So the question continues to be asked around Wayne County. When can you go to the hospital? When will the cafeteria open? When? Have any idea when those decisions could be made? Do not. Part of the problem with the cafeteria is the cafeteria is connected to the building, and when people come into the cafeteria, they're considered visitors. And the governors, and if you look at the federal guide to the reopening of America, it talks about no visitors in hospitals. You can do elective procedures, which we're doing. I'll talk about that in a minute. We're doing elective. When people come into the cafeteria, they are considered visitors. So if there's the governor's order and the reopening of America says that we cannot have visitors, then that's where that falls right there. So, that's dictated by the state and the feds. But then, we're also going to look at, if that's lessened, we're going to look at and see how things are going here locally. Even though they may say, well, the state of Georgia can let visitors in the building, but if we see that, maybe we've had a few cases in the last couple of days, we might want to wait. And it's just best to, as inconvenient as it is, and it's inconvenient, it's just what's in the best interest of all right now. The hospital is back open for business. We've been doing elective surgery now for over 2 weeks. We've put some different measures in place for the safety of our patients and our staff. But again, you have to remember, we deal with contagious diseases all the time, and we just use our universal precautions. So this really isn't anything that's that new for our folks. But we're back open for business. We're doing surgeries. We're doing our radiology care. We're doing our labs. Everything is open. I encourage folks that have put off some things that need to be done or need to be checked on. I encourage them to contact their physician and get those tests and things back lined up, because there's a big concern that a lot of folks may have had to have something done, or they've put it off, and not going and get that back done could cause some problems down the road. Economic impact's a big story as well. Everybody seems to take an economic hit. What about the hospital? Have y'all been able to maintain the full staff? Have any layoffs or anything?
No layoffs, no furloughs. But our volume in April took a pretty good hit, like everyone else. When you're not doing electives and folks are staying away, our volumes were down, and down a pretty good amount. But nothing that's going to be detrimental to how we operate our organization. That's why as soon as we could, we went ahead and put the measures in place to get cranked back up and ready to roll, to be able to see people. And that's what we're doing.
You see doctors all the time at the hospital. What do they say? Have they seen much of this pandemic, and have they talked about patients that they've seen, or
I think visits like us and during the month of April for most docs, I don't know any specifics, was probably down because people were just not going to the doctor. Now, a lot of folks were using kind of the telemedicine where they were doing visits, via camera, whether it be a FaceTime or a Skype. I think there was some of that going on. But, a lot of folks have put their medical care on hold for obvious reasons. But, I would warn against folks if they were having something done, whether it be their routine yearly or, something that they were maybe looking for to rule out something that they really consider, talking with their physician and getting that back to looked at, because, that's something we don't want to happen. Early detection.
Right. Like I said, people can't visit the hospital, but if you're at the hospital every day, are people wearing masks, or are they doing social distancing, sanitizing everything?
Oh, yeah. I mean, when you look at a hospital, I mean, it's got to be a clean place to begin with, obviously. So, again, a lot of that hasn't changed. What we have done is, folks limit what areas they go in if they really don't have to go into those areas. If non-patient care folks really don't belong in the patient care areas, they don't go in there. And that's for, obvious reasons on both ends. But, dealing with things like this really isn't anything new for us. It really isn't. It's just it's the biggest thing has been it's all the external factors that have come involved with this.
Well, again, no idea when things will change. Again, just waiting on the governor. Like I said, right now things in the state of Georgia seem to be going pretty well. Like I said, hadn't really heard any disaster stories. Like I said, everybody it's like the results haven't fit the narrative. The media's already nationwide has already said it's going to be gloom and doom. So the fact that it's not gloom and doom doesn't meet their narrative. So now they really don't know.
Bob,
so everybody's just keeping their fingers crossed that things continue to go well and things can continue to open up. Me and you talk about it every day. You're my color man in football. We're just hoping for a high school football season. Just hoping and praying that GHSA will open it back up. You got a son involved. He's chomping at the bit to get back out on the playing field.
Boy, I tell you, you're not kidding. I mean, this sports thing, I'm telling you, I like NASCAR, okay? Man, I planned my whole weekend around watching that race. I mean, it's, there's so many moving targets.
Here's my question about the NASCAR thing. I'm sitting there watching the race. Nobody in the stands. Drivers run around. Fun. But then they go in the pit, and all the pit crew comes flying out there, and they're shoulder to shoulder. Where's the social distancing on that? So they're not worried about the pit crew.
You're right.
I mean, things you see things, you go, well, that doesn't go in line with social distancing. So how's that work?
It doesn't.
So much for the pit crew.
Right. This was so new to everybody, and no one knew how to react. And you had these models out there that were saying that 2 million people were going to die from this. And, it scared everybody, and it scared all of us. And no one knew what to expect. No one's ever dealt with this. But I think now as we the dust starts to settle a little bit, we start to see what the virus is about and who it affects more than others. And you hear about and read about all the different promising rapid testing and testing for the antibodies and the vaccine, the progress they're making with vaccines. So I think we're going to see a lot of things come to light here in the not so distant future.
I think what you're going to see too, we're talking to somebody over the weekend, what's the long-term effect going to be? I think what you're going to see is a lot of people move out of these big cities. They're going to leave New York, going to leave California. They're going to look for, they look at a place like Wayne County that's been 2 months with 14 positive cases. That might be a nice, you know what I'm saying?
Sure.
That's what I think is going to happen. I think a lot of people are just going to reassess, where they live, and try to find some place,
Well, especially if people can work from home.
It's always nice to live in a small town. There's a lot of advantages. This seems to be another advantage, because like I said, we haven't had the 14 has stayed there, stayed at 13 for 4 or 5 days, 14. So we don't see a spike so far. But I'm like you. I think Wayne County, the leadership
done a great job.
Came out here early and told everybody what to do, put the social distancing in place early, shut down things early, and I think it's proved to all be beneficial. So, and knock on wood, hopefully it'll remain the same.
Again, I can't stress enough, use good judgment. If you don't feel good, stay. That's the number one thing you can do. If anyone asks me what's the thing, If you don't feel good, stay home.
Well, hopefully the cafeteria one day will reopen because Jonathan's in hospital cafeteria withdrawal.
You know, I mean, it's different when you go in there.
It's been tough for him, you know.
It's different.
His daily routine is just totally out of whack. It was funny. The other day, there was a person that used to work together, had a birthday, and I heard him say, "Happy birthday, so-and-so." Oh, I hope it opens up soon.
That's a nice thing that folks miss the cafeteria, and if you talk to our food nutrition staff, they miss their customers too. They miss the folks too. But I'll tell you what, though, it sure is nice to be able to go in and out of there real quick, especially when you're busy, to go ahead and grab something to get back upstairs.
I said, people just need to be patient. You know, hopefully, like I said, hopefully the governor's, continues to open things up.
Yep.
I said right now, like I said, for elderly people, and unfortunately, that seems to be the people that this hits the most. Those are the ones that are at risk.
I think I read 51% of the deaths in Georgia are by nursing home residents. That's a lot. And I think almost 75% of all the deaths in Georgia are people over the age of 70. And then of that 25% of those deaths, a lion's share of those folks that passed away had other underlying health conditions. So you and I talked about this some time ago. We see how many folks have passed away, but we don't see how many people have recovered from this.
See, that's what I wish. I wish they would do that. Like I said, I talked about that hearing up in Washington a couple of weeks ago when they were all around the table. But and I said, I can't remember who made the point, but he made a point. He said, why don't we just start talking about the number of people that have recovered from and put those figures out there and let people have at least a good story to tell. I thought that was a good idea.
Sure.
I'm sure there's thousands and probably millions.
It's like 1.4 million have gotten it, and 80, 90,000 people have died. Just do the math. Over 1.3 million people have recovered from this.
And most people do. I think they said like over 95% of the people that get it do recover from it.
95% of the people that get it ride it out at home. So those are people that know they've gotten it. So how many people have gotten this thing and never got tested, or maybe didn't even know they had it? I think when the antibody test comes out and you can test for folks that antibodies that know that they've had it, I think there's a potential, and I use the word potential, that we will be shocked in the amount of people that have had this thing and didn't even know it. I think there's potential we're gonna be shocked, and if that's the case, then that changes everything. But the other question is, and I was talking with a physician, and there's a strong belief out there that this virus could be like chickenpox. That once you get it, maybe you become immune to it, and you don't get it again, or like chickenpox, I guess has come back in older folks as shingles. But you're immune to it for potentially forever.
What's your thoughts on a vaccine? You hear different theories about that. How soon a vaccine? You talk to doctors and all that. What do they tell you? They think one will be.
They see the progress on a vaccine has been unbelievable. How far they've come with a vaccine to be able to get one out there, and I'm hearing sooner than later that there's something that's going to be approved to put out there. 7 or 8 months is definitely 6, 7, 8 months is definitely possible for a vaccine. And that would be, that would be fantastic. But, as far as, I think I read the mayor of Los Angeles said that they're going to keep Los Angeles closed until they find a cure. That's just not realistic. And I think that's something we need to look at as a society as a whole. Is we've got to deal with this thing. We need to do the things that we need to do to deal with this thing, but to be able to stay at home until they find a cure for this thing, I think is utterly ridiculous.
It's amazing. It's interesting to watch the different states, how they react. Like I said, I talked to my sister. Like I said, she lives in Virginia. She's frustrated. They've shut everything down for a couple more months. California, as you mentioned, they're talking about shutting everything down to the end of August, which there's just a lot of people are flying out of Los Angeles as we speak. But anyway, hopefully, like I said, things will continue to go well here in the state of Georgia. Like I said, the governor was one of the ones that opened up early. Everybody criticized him when he did it, but so far things have gone extremely well. things have gone well here in Wayne County. I talked to business. Talked about last week. Went to a restaurant Friday night and ate, had a good time. Got my hair cut. Got trying to get back.
It's time.
Talk to those people. They seem to be following the guidelines and doing everything they're supposed to be doing. So, knock on wood. Hopefully, it'll continue to go well.
It's an inconvenience. It's an inconvenience to doing these things for business owners and for us as who are customers of those businesses. It's a little bit more inconvenient for everybody.
We're still a month away from the possible date of graduation. I talked to Jay Brinson yesterday. Like I said, that we had the story about how different schools are handling graduations and things like that. And like I said, Saturday, July 18th is the date they've got, but they still have no idea how it's going to work, how it's going to be limited. If it's going to be limited at all. Who knows? Maybe they can have a regular graduation ceremony July 18th. Just don't know. But again, he's still under the guidelines like you are. The governor's right now dictating everything. So. Like I said, they've got that date, Saturday, July 18th at 10 a.m., and they're just hoping it'll all work out, but they still don't have the details. They still have plenty of time to get all those details worked out between now and then, but it's interesting to see all the different
it's a tough line.
Graduation, you just and everybody's heart breaks for those seniors, whether it's college. I was supposed to be in Virginia this past weekend at my niece's graduation. She graduated from William and Mary, but they didn't have any ceremony. She had the cap and gown. Pictures were taken at home, but no guests. It's just kind of sad. Okay, so again, let's get back to the football. Georgia High School Association, they continue to get information. They seem to have a plan in place, but it's going to be interesting. They're talking about limiting the practice to a number of players each session, so I wonder how that's going to go.
I don't know how they're going to do that. That's another one. I mean, there's a lot of moving pieces to that, and there's a lot of ways, there's things you have to do. If they're talking about, only 10 people at a time, I mean, that's tough. I mean, I don't know how you could practice with only 10 players when 11 are on offense and 11 are on defense. I don't know how you practice for 10.
Oh, yeah, I said it's just interesting to see all the theories and all, and we got recreation starting up on June the 1st. I expect it's going to be in here later this week. He had the coaches meeting, talked to him yesterday. Apparently the coaches meeting went pretty well. He said there were a few coaches that didn't want to take their team out there and play, but the majority did. So, like I said, that was fine. But hopefully that'll go well beginning in June. So.
Bob, you go back to a point. If someone's uncomfortable, then they should absolutely do what they feel they need to do. I think that was something the governor was really good about. You don't have to do anything. You can make a choice, and if there's some folks that are uncomfortable going places, then by all means they should stay home, and they have their reasons, and we need to respect those.
All right. When the governor's made that clear, it's not a mandate that you got to go back to the restaurants if they open up.
Right.
You don't have to go to hair salon. It's personal choice. You can do what you want to do. But Joe, we appreciate you coming in. Like I said, it's been a while since you've been in. You were in, like I said, this is almost like 9 weeks ago. I think here when you first began. It was interesting. The Seating County came out with their guidelines first, and 3 days later the governor stepped in, and everything was wiped away because everything is dictated by the governors. And I still want to stress that. A lot of people don't understand. Everything right now statewide is dictated by the governor's executive order. Everybody's following his order. So until he lifts other restrictions as far as gatherings and things like that,
we got to go along.
We got to go along with it and just be patient.
And so far it's worked.
Right. And like I said, hopefully one day we'll have visitors at the hospital and have the cafeteria back open.
Live sporting events with people.
It was interesting watching the golfers carry their own bags. It didn't seem to bother them though. But I noticed they were all in shorts though too.
Yeah, so. They're all banned.
I don't know who this Tom was. I was one guy I wasn't familiar with. He could mash it. He kept winning the long drive. So, but it was fun to watch. It was fun to watch the NASCAR. As I said, it was just fun to have something.
I want to watch a baseball game.
Yeah, I'm ready for the Braves to get back in action. I said, but I'll tell you, I'm worried about the baseball because the players continue to argue about the money situation. They're not happy with the part-time salary. So if they have enough players balk at that, baseball could be gone for the entire season, which would be sad to see.
It would be.
Most people think they're going to have baseball, but I said the more I hear some of these players and their opinions, and they're the ones at risk. So,
well, Bob, here's some good news. We're maybe 2 months and a week from the opening of NFL football training camps. So if baseball's not playing come mid-late July, that's when the NFL starts cranking up their training camps. Hopefully, if they're on time. So. we'll have something.
It's just going to be interesting to see if baseball does have that 82-game season. And I said, most people would like to see it, but it's going to be interesting how they do it as well. I've heard they're not going to let anybody in the stands, and I've heard they're going to have certain, every 3-4 seats. So you just don't know how they're going to do it. So same thing with college football. Some say they're not going to do it unless students are on campus in the stands. Some are saying they're going to do it. There's so much still to be determined in all these sporting venues, and it'll be interesting how it all plays out. But I got my fingers crossed, hoping for a football season, especially high school and college football.
Man, but if we're still talking about this come football season,
I just know there's a lot of, I talked to a lot of friends of mine, University of Georgia, University of Alabama, Clemson. Those colleges can probably survive without a football season. But there's a lot of universities around this country that college football is the money-making capital of that university. And without a college football season, there may not be university.
And the television. The television companies.
The TV revenue, right. So, anyway. Joe, always good to see you. Appreciate you coming in.
Appreciate it.
Jonathan, have a good Monday, and we'll see you on Tuesday.
All right, Butch and Bob Show on WIFO FM, brought to you this morning by Murphy Builder Supply. Good morning from the Big Dog WIFO at 8:29.
Congratulations to the graduating class of 2020 at Wayne County High School.